Okay, it looks like everyone is out of the waiting room. So welcome to this week's COVID-19 office hours. Happy Juneteenth, 2020. So happy that we're finally recognizing this very important day in our history. And so thanks for jumping on the call. There's been a lot going on, as we all know, both with COVID and the other pandemic of racism. So just want to continue to start our time each time we do meet with a moment of silence. So if you would join me now for that, I'd appreciate it. Great, thank you. So I'm John Mers. I'm one of the three co-chairs of the Balance of State, and welcome you to this meeting. Our agenda is the same as it's always been for folks who have been on these calls before, that you see before you, or if you're on a phone call that you received through a link or a PDF. So thanks for joining us, and without further ado, just want to go through a couple slides of announcements. I believe most of them are ones you've seen before. We've got the CDC testing guidelines. And again, a reminder, all of these slides are available to you before our time together. If there is something that's underlined, it means that it's a link. So the CDC testing guidelines, for example, if you click on that link, it will take you to more detailed information. We only have an hour. We pack a lot in, so a lot of what we do is with links, and so just be aware of that. So reminder that there are new dates for the census count for folks experiencing homelessness. So it looks like it's been moved to September. For those, what is that, just 2 days that it's been extended, or 2 days that they're going to be out in the shelters?
2 days that they're going to do the intensive efforts to count homeless people.
Okay, so we all know how—
3 days, I guess it's 3, 22, 23, 24. Yeah.
Okay. So we know how important it is to have everyone counted, because it ties back to our federal funding, and we only do it once every 10 years. So any help you can do, if a census worker reaches out to you, please, please, please work with them, as I know you will, to make sure that all of our folks are counted. Again, there's a link for more information at the bottom of that slide. So HQS re-inspections, post-exit, there was a question on our last call 2 weeks ago, and a reminder that if you put a question in the chat box that we're not able to immediately answer, we do go and do our homework. And when I say we, I mean Housing Innovations, who are our consultants who support the Balance of State. So they go, they look for the answers, and then we report back to you as soon as possible. So there was a question about if someone exits before the date of the required reinspection, do we have to go back and do that? And basically the answer is no. It makes no sense to go to a unit that's already been vacated. So, and then there's some small legal print at the bottom of the slide that you can read at your leisure. But again, we really appreciate these kind of thoughtful questions and hope that they keep coming so that we can all be on the same page. Next slide talks about the eviction moratorium, and it's important for folks to know that that is extended through July 24th. Also, just be aware that a lot of our friends in the legal aid world are pushing to have that extended even further. So if you are so inclined and you get an invitation to sign on to an extension, feel free to do that if your agency supports that. So while it's important to know that folks cannot be evicted, we certainly encourage all case managers to work with their clients to ensure that they don't face a cliff at the end of this moratorium, that if they're able to pay their rent, they certainly should. If they're not able to and they're eligible for rapid rehousing, financial assistance, they absolutely should apply for that. We want to make sure that folks who are not homeless remain not homeless, right? We need to make sure there's not a cliff at the end of the summer. So again, additional information with some links, including one for a flyer that can be posted or sent to clients or handed out virtually.
And those are new resources.
Great. Our partner CCEH is doing an eviction webinar that's going to happen on Thursday, the 25th, next week. Click to register on that link. Again, a lot of moving parts, really fast, a lot of good information that we need to sort of get through the noise of everything else that's bombarding us. So if you have an hour to join them, please do, even if just one person per agency can attend, and then sort of farm out the information after Thursday. That'd be great. So we have COVID websites from our partners at HUD, and there's a new one, disaster response rehousing. Again, these are just chock full of information, so click on them at your leisure over the weekend. It's your excuse not to have to go to a family barbecue. If you need a written note, I will give it to you, but none of the information that we give to you is worthless, but it's a lot. And so sort of chunk it down as you can and digest it and send it out to your network so that everyone, again, is on the same page and we're doing right by our clients. Some of us are going to be spending a good chunk of today together. So after this meeting ends at 12, we're going to give you a half-hour break to get your lunch, do your hair, find a hat like mine to wear to the semi-annual meeting, 12:30 to 1:30. It's not too late to submit a nomination if you want to be one of the 3 co-chairs, going once, going twice. And the Zoom, again, is embedded here, as well as a calendar invitation for those of you who use Outlook. That meeting also is going to be chock full of important information as it relates to data out of the HMIS system. So if you can join us for the afternoon meeting, please feel free to do that. Again, these meetings, these webinars are recorded. The chat box is recorded, so if you're not able to join us for that meeting, we will make sure that you can look at it and see that video at your leisure. Again, here's where you click if you want to ask us a question, or if you want to visit all of the updates that we've posted to date. So we want to be your one-stop shopping place for all good COVID information. So without further ado, I'll turn it over to our partners from First DOH.
Thanks, John. So I'll take off a little bit from what you were just speaking of as it relates to eviction prevention. So DOH released RFP yesterday for eviction prevention program. So please go to the DOH or the DAS website to take a peek at that to see if you guys are interested in forming partnerships to apply for that. So basically that is using ESG funds. So we need to have individuals who are at 50% of AMI or below, and who also have a notice to quit to be eligible for that program. So we look forward to having applications come in. It is a tight turnaround. We do want to get these programs up and running as quick as possible. So it's only a 2-week application process as opposed to the typical 7 weeks that we do. But we know, as John showed, we're trying to get get these programs up and running before the moratorium ends. So that gives us the ability to actually assist people instead of letting them go through the process and then having to come to us to try to rectify things. We're excited to announce that opportunity. So please, once again, go check our webpage to see what we're looking for. In terms of other resources, pretty much the same as last meeting. We currently are in the contracting process to reimburse our CAN partners for their additional costs from March to June for COVID-related additional expenses. So I just got the Attorney General approved contract language a few minutes ago. So hopefully we'll be able to get those contracts out to you guys next week. Or at least the CAN backbone organizations next week, so that they can execute them, and then we can pay you guys out on that. Also, last time we explained our 1,000 homes initiative, where we're trying to house 1,000 folks over the next 120 days. So in order to do that, you guys need the resources. So we're also in the process of contracting out the first round of ESG, in which $4 million is going to wrap rehousing, $2 million for services, $2 million for rental assistance. In that interim, we got an announcement from HUD for the second round of ESG, which DOH will receive approximately $12 million. So we're working on trying to figure out how to split up that $12 million to create resources for the entire system that will be the most effective in ensuring that we are doing our best to mitigate the effects of COVID amongst the homeless population. So we also know that hotels were slated to end at the end of the month. However, we've been working with the CANs to give us updated numbers on the number of hotel rooms that they believe that they will need going forward in July. So we got all that information in today. So it is a pretty substantial reduction, which we're happy with. And because that reduction indicates to me a couple things. First off, it indicates that we are working on getting people housed, which is great. Secondly, we are working on standards to ensure shelters are as safe as possible. And third, showing a reduction gives us a better chance to go to FEMA and get that approved, so we can get the federal government to pay for those resources. So we will be working on that. But either way, the commissioner has committed to providing those hotel rooms. So what your CANs have given to me is what we will be going forward with. So we're excited about that. So hotels will not be ending in totality in July. However, they will be reduced approximately, it was between 37 and 40%. Each CAN was a little bit different, so if you have any questions, please contact your CAN representatives to see how many hotel rooms in your area were requested. So I think that's where DOH is now. So with that, I'll turn it over. I'm not sure if Alice is here or Brenda from Demas, but I'll turn it over.
Alice is here. Alice.
All right, well, there you go.
Thanks, Steve.
Thanks, Steve. So just a couple of brief announcements from us. I know I've talked about this funding in the past meetings. Demas has received the funding from FEMA for the crisis counselors. We're working with the provider agencies to hire staff to do that. It's, again, very short-term money. We are applying for some additional money that would bring us to about a full year's worth of funding for the crisis counselors. And this is to help folks who are experiencing homelessness and have some crisis related to the COVID pandemic. And so people are eligible to receive these services. They're really more of, quick minute, 15-minute incremental sessions with people to really assess them. If folks need additional services, the crisis counselors can refer them to additional services that already exist. They're unfortunately not really able to do any sort of housing matching or things like that, but we are having the crisis counselors connect with the CAN and the CAN managers so that we can make sure that the folks who are experiencing crisis related to COVID get these services, and then get the linkage to possibly longer term services if they need and want those. So that's really exciting. The other, sort of announcement I have is there is, and I can send this to Liz or I'll figure out how to put it in the chat, there is some upcoming trainings that are being done by Connecticut Legal Rights Project and the Commission on Human Rights and Opportunities related to fair housing for folks with mental health disorders. And then there's one for folks with lived experience. And so both of those are free webinar trainings. And like I said, I can get that out to Liz. If anyone has any questions related to the crisis counseling grant and the extension, feel free to reach out to me or Brenda or Lisa. I'm not sure if either of them are on the call, but definitely reach out. Actually, I know Lisa's not on the call. She has a day off. So just reach out to us and we'll be able to hopefully answer your question, or if we can't answer it at that moment, we will get the information for you. So with that, I will pass it on to the next person, or back to John, actually.
That's fine. So Alana from HUD is with us on the call. For those of you who are new to the call, and even for those of you who've been on every call, I can't underscore enough how important and how blessed we are with the relationship that we have with our local field office from HUD. Alana is just, and her staff, a true partner with us. I feel like they're really in the trenches with us, and that they provide so much good information and such good support to us that I just feel like I always have to do a shout out to her and her team. So Alana, what do you got for us?
Well, good morning, everyone. Thank you so much for that, John. We appreciate it. As many of you know, like many of you, we've been mandatorily teleworking for the last 3 months, and you know, the team has worked very hard to come up to speed on CARES Act funding. We're trying to turn around any CARES Act applications that come in within 72 hours. That's our internal goal, to have grant agreements out to the 5 ESG recipients within 72 hours if everything is in order. But we would at least give them an answer, you know, one way or another before that. So as you know, I think I talked about this last week, round 2 of ESG was announced last week. It's an additional $18,937,368 to Connecticut's 5 ESG recipients. That's the state of Connecticut, the cities of Waterbury, Hartford, New Haven, and who am I missing? Let me look this up. I can never remember them off the top of my head. Did I say Hartford? Hartford, New Haven, Waterbury, Bridgeport, and the state of Connecticut. That's our 5. So right now, the only approval that we have is for the state of Connecticut round 1 of ESG funding. Bridgeport's round 1 application just came in yesterday, so that is presently under review. We don't have the others yet, but we're hoping that we'll have them soon. And grantees have been advised if they receive more than ESG funds, which all of these grantees do, they don't have to apply to us for all of it at once. They could, for example, just submit ESG, and I think that's the path that the city of Hartford is going to take. I think we'll have their ESG application before we have their HAP or CDBG application. So we are keeping in close communication with all of our entitlement grantees. And again, we're hoping to receive, in particular, the ESG applications very, very soon. We are giving them advice and guidance about how to potentially combine round 1 and round 2 if they haven't yet submitted for round 1 and now they have round 2 funding. So we're trying to make that as easy as possible for them as well. Internally, with regard to workload reassignments in the Hartford CPD office, if you're getting or if you've been assigned a new CPD representative, you should have had a letter from me by now. If you haven't heard anything, that means that the CPD representative that you've been working with is going to stay the same. I do add a little bit of a caveat to this. We have 2 new staff that will be coming on board So there will be some additional minor changes going forward, but when new staff comes in, I try to give them, 90 days or so to come up to speed, and I don't assign a workload right away. So any additional changes, you won't see for another 3 or 4 months. So other than that, I think that's it, unless anybody has any questions. I still haven't heard anything about the upcoming competition. We'll certainly let you know if I do.
You should have seen Suzanne's face when you said that. She's like, that was my one burning question.
Exactly.
I know.
Wow.
I know. They're so
There's-
busy with the notice and the funding,
Well, and we rest on the good news from the last time that you won't be doing any monitoring.
Correct.
Foreseeable future. So we'll take the good news where we can get it, and I'm sure that as soon as you know about the NOFA, so will we. So thanks,
Yeah.
Alana.
You'll probably know before me. It's usually what happens.
We do have our moles. All right.
But
moving-
that's good. As long as you know about it, that's what we care about.
Yeah. Okay, we're going to move on to Dan from DSS. Happy that he's able to join us and that we've started to form a close working relationship with the Department of Social Services. So Dan, take it away.
Thank you. Good morning, and thank you for having me back. There's really about five or six quick points that I just wanted to give an update on and reintroduce myself for those of you that didn't get a chance to meet me the last time I was on. My name is Dan Giacomi. I'm the SNAP Program Administrator for the Department of Social Services. So I oversee the SNAP or as people often refer to it, the food stamp program here for the state. So most of the updates I'll give are about the SNAP program, but I do have a couple of other points that I wanted to make about some of our other programs. In regards to SNAP, though, the first is that we continue to offer our emergency SNAP allotments, and those are for households in the state that are not receiving the full amount of SNAP benefits for one reason or another. We started this program in April, covering the benefits of March, April. We then moved on to May, June, and we're looking to do it again in July. And we've been able to reach out to approximately half of all of the households thus far receiving SNAP benefits here in the state. And it's been about $66.5 million in additional SNAP benefits that we've been able to provide to households. The second point, or the second update I wanted to give, and it's something I mentioned previously the last time I was on, is we have gone live with our SNAP online purchasing here for all residents in the state that are receiving SNAP benefits. We currently have 3 partners, retail partners here in the state. The first is Amazon, which offers 3 different shopping services. There's Amazon groceries, which is just your normal bulk items, like if you were going to a Sam's Club, a BJ's, something of that nature. Amazon Pantry, which is just your normal 1 or 2 everyday non-perishable items. And then Amazon Fresh, which is operated through Whole Foods, and it does your perishable items, your fruits, vegetables, meats, things of that nature. The second partner we have is Walmart, and we have 12 Walmart stores here in the state that are currently offering either pickup and delivery. And then the third is Wakefern Food Corporation, and Wakefern is the corporation that oversees a number of ShopRite stores here in Connecticut, as well as in Massachusetts, New York, Pennsylvania, et cetera. And there's approximately, I won't even say approximately, there are 21 stores, ShopRite stores here in Connecticut that are offering delivery for SNAP beneficiaries. And what I'll do is at the end, I'll put up the 2 links. The first is to our SNAP webpage, and the second is to our state DSS COVID response page. If you go to our SNAP webpage, we actually do have a listing of all of our Walmart and ShopRite partners that you can go to see which store and which town offers the delivery or pickup options, as well as for Walmart, which ones we have coming in the near future. We have around 3 or 4 that are going to be coming within the next 6 months on board as well. So we're very excited about that. The only caveat to that is that you cannot use SNAP benefits to purchase or pay for the delivery or service charges. You would have to use either a credit or debit card to do those. Though Amazon does offer free delivery for purchases over $35. So if you're doing a whole large grocery order, you can have free delivery from them. The others, Walmart and ShopRite, their delivery charges usually range in the from $4 to about $10 we found, and we're trying to look for ways to kind of lessen that burden if possible. The next one is the big one that I spoke of recently as well. That's the pandemic EBT, and what that is for the households of children who are in school receiving free or reduced price meals in school, but that we're no longer able to do so, obviously, because schools were closed. We broke it up into 3 different groups. The first group is those that were receiving SNAP or TANF benefits from DSS. The second group is those that were receiving Medicaid benefits from DSS, and the third is everyone else. So we've gone forward and have issued benefits to our groups 1 and 2 already. That was approximately 205,000, just over 205,000 children in the state. And we're going this weekend, actually, so this Sunday, for the group 3. So that would be all of the individuals that are not receiving benefits from DSS. That includes our foster care, our homeless individuals that perhaps are not receiving benefits, our undocumented students that were not receiving benefits, things of that nature. And that's another around, I believe I have 82,000 students that we would be covering. The reason we're happy or excited that we appreciate being offered the ability to do this program is that this brought in just under $105 million in additional SNAP benefits for the state. And those of you that know anything about the SNAP program itself, you know that the purchasing power and the multiplier for any benefits that come in and the economic activity that it produces is around a 3-time multiplier. So if you take the $105 million multiplied by 3, that's the amount of estimated economic activity that's coming into the state. So that was a tremendous help for us to be able to do at a time when obviously our unemployment rates are skyrocketing, our participation rates are rising, things of that nature. So those are, as I said, the 3 main SNAP updates that I wanted to provide. The other 2, the first is the new coverage groups that we had for our households, and especially our uninsured and our undocumented households in regards to COVID-19 testing. As of June 12th, we had around just over 1,300 individuals that qualified for the new COVID-19 testing that the state is offering. This includes 712 in the uninsured COVID-19 testing group and another 598 through emergency Medicaid. And your 598 emergency Medicaid are normally our undocumented individuals that needed to have services for COVID-19 or otherwise. And then the last thing is a plug that I've been putting through and that we've been asked to do some outreach on is regarding the stimulus payments. There was a report that came out from a advocacy group, the Center on Budget and Policy Practices, CBPP, that estimates that there's around 12 million Americans that risk on missing out on the stimulus payments provided through the recent CARES Act because they, unlike those of us that receive the payments automatically through the IRS, these individuals must file by October 15th of this year in order to receive the stimulus payment. And what we found is that these are the individuals that obviously, 1, do not have ready access to a computer, that 2, don't know that they need to file, that, fall into a number of groups. But we're really trying to get the word out through all of our partner agencies to let them know that this is an issue, that this is money that these individuals are entitled to, and that if they want more information, they can go to our DSS COVID website. So let me just put them both in there so that you have them. As I said, the first website that you'll see that I just posted in our chat is our SNAP website. That'll give you more information on all of the updates for the SNAP program that I just provided, as well as any other additional information regarding the SNAP program that you could be looking for. And the second is more of a holistic DSS COVID-19 response website that also has a link towards information about some of our partners that are offering help in applying for the stimulus payment, as well as any other information that you could be looking for as to how the department is responding to the COVID-19 pandemic. So as I said, that's all I really have. I thank you again for allowing me to come and speak with you, and I appreciate all of the great work that you all are doing.
Great. Thanks, Dan. And you're also working with the Connecticut Association for Human Services promoting their virtual VITA, which
Yep.
they work with volunteers who will do free tax prep through July 15th, the economic impact payment that you talked about, and the pandemic unemployment. So I know you've sent out virtual postcards to about 200,000 people. I think our job could be to just make sure that if folks get that information, that they know it's legitimate. And I just posted the link directly to Virtual VITA, so Volunteer Income Tax Assistance Program. So thanks, Dan. We're going to move on to our featured presenters. If you have questions, let's use the chat box, because I want to, Suzanne has one question. Only Suzanne can ask one question. The rest have to use the chat box, and then we're going to move on to our featured speakers. Suzanne.
This was just a follow-up to Dan. Thank you so much for the information, and so great that you guys are doing all that good stuff with SNAP. Is the online purchasing going to stay after the COVID crisis is over? Oh, wonderful. Okay, thank you.
Yeah, that's actually a great question. So thank you for asking. We're actually looking to expand it once the crisis is over. So now that we have it up, there's no thoughts in our mind of letting it go. In my opinion, and I've done a few different press events on this. This is something that we've needed for a number of years, because this puts our SNAP recipients on the same footing as any other citizen in the state of Connecticut to be able to shop, purchase groceries, do the same things that we're doing in the same manner that we have. If they want to go to the store, they can still do that. And some people we've found do want to do that. But if they want to be able to purchase the groceries from their home, they should be able to. So what we're actually pivoting towards right now is trying to work with the Connecticut Food Association, who's the retailer liaison that we have that works with the retailers, to try and get more retailers involved in this program and to get an online presence, because we know that although we have 3 large retailers, that there's a number of areas or a number of retailers that have a higher presence in some of our more urban centers that we would like to get on board so that they can offer this benefit to individuals and be able to reach even more of our clients. We look at our Price Right, our Big Y, Stop and Shop. Those are major retailers in this store. And then you look at some of the smaller ones, your IGAs, your Krausers, your things of that nature that we could really get a foothold in to be able to get more individuals to be able to utilize this benefit.
Great, thanks. Okay, so Andrea Getz and Shamika Jones from Beacon Health Options have agreed to be our on-the-ground strategist today. And without further ado, we'll advance the slide and have our 2 guests introduce themselves and talk as quickly as possible through your slides.
Yes.
Thanks and welcome.
Thank you so much. Thank you for having us. My name's Andrea Getz. I'm the Chief Administrative Officer at Beacon Health Options, overseeing the Child and Family Division. I believe you had Liz Downing here recently attending one of your meetings to talk about the other division of Beacon, which is the Behavioral Health Partnership. And this is a newly formed division that has several programs within it. I'll let Shamika introduce herself quickly, and then we'll move on to what the programs are within the division.
Hi, my name is Shamika Jones, and I'm the supervisor of the Intensive Care Coordination Program, which is a part of the Child and Family Division, and I'm also a statewide wraparound trainer.
Okay, so you can push the slide forward. So these are the several programs that we have within the division. Each of our programs has something to do with trying to increase access and accessibility to behavioral health for children and families in Connecticut. Access Mental Health is a doc-to-doc program where pediatricians can have direct access to psychiatrists that are on staff. This is a statewide program, and so that's called Access Mental Health. The Connecticut Network of Care Transformation, the CONNECT, is a federally funded grant to help create a more integrated system of care so that families can access services in a high needs, mental health services in particular, in a timely and effective manner. The intensive care coordination is the program that Shamika oversees, working with children and families at risk of returning to hospitalization or residential treatment. The Integrated Family Care and Support Program is one of the newer programs where we get referrals directly from the Department of Children and Families to Beacon to provide some short-term care coordination for families that have been through an investigation but have been determined to be safe at home. So our job is to help them connect families to community-based supports and services to help the family thrive, basically. And the Voluntary Care Management Program is our newest program that launched on May 1st. This was formerly known as the Voluntary Program through DCF. This is a way to be able to connect children with high needs mental health services that have traditionally had difficulties accessing care, either through limitations with insurance or other challenges. And so this program helps create that access for families. Okay, I think we can move forward. Okay, I'm going to let Shamika talk about two of our programs, Intensive Care Coordination and IFCS, really focus on the wraparound process and engagement of working with children and families. And so we wanted to, give you some on-the-ground strategies of how we help best connect with families, particularly during this time. So Shamika.
Thank you. So I'm going to try to be more practical and less information about the philosophy of wraparound, but many of you may have heard of the wraparound approach to care, which has been in Connecticut since the early 2000s. And it started out as kid care. Many of you may know that term, kid care. But basically, it's a trauma-informed process that really focuses on the family's experience of receiving care. And so it really is a partnership in ensuring that families feel that they are being heard and that their voice is the strongest voice on their team. We utilize kind of the idea of the 4 H's, which is a very fluid process. It's about engagement, then it's about actually activities that are going to help the family. And then the hope is that those activities that we're doing to help the family will actually provide them with a sense of relief. And once they have that relief, then we see that many families are then able to be hopeful about their future. And so just to, for those of you that are not familiar with wraparound, wraparound is a team approach. And so you cannot do wraparound without a team. And so our staff are really coordinating here and making sure they grab anyone from the community, from friends, families, coaches, housing support, school support, DCF. A lot of our families are DCF in my program, IFCS, not so much. But we are looking at everyone in the system of care that can help. We work to get them to be a part of the family's team. With that, we have seen that families have better outcomes because of the team approach rather than kind of, sometimes we work within these silos and we're trying to help a family, but we're not kind of coordinating all together to make sure that we're not duplicating services or undoing the care or support that we're providing by another provider who may not be on the same page. And so really it is about not just services, but really generally care. How are we developing a plan of care for the family? So within, most recently with the COVID-19 pandemic, we've been working with families, unfortunately, through telephone, Zoom, and these virtual platforms. what we have found is that there have been challenges, of course, but there have also been some things that have been working out better. So one of the things, like I said, because we're a team approach within the wraparound process, is that we're able to get teams together better before people are out in the community running around, seeing families and have their own caseloads. And now people are more available to meet and discuss the needs of the family. And so we call those child and family team meetings. And so we've been able to actually have more child and family team meetings during this pandemic, because we're able to get people together on these virtual platforms in an easier way. And so people are more available because people are home. You know, you can't say, oh, I'm busy, oh, I'm doing this, I'm doing that, because we all know that you're home. So we've been able to get the team together, discuss the needs and strategies that families really need. And then the downside is that some families really need you to be present physically with them. And even my staff, they prefer to be present physically with families so that you can really feel and understand the challenges that families are going through. And so, upside and a downside, one of the other things that we found too is that with regard to engagement, I will say, you know, with the families that we work with that are DCF involved, the challenges haven't really changed. So many families are ready and willing to work through the wraparound process with us. And those families that we would have would have had challenges with engagement in the first place, we still have those challenges. And so it really hasn't changed due to the virtual platform. Some families are just more eager, whether it's virtually or not. And some families, you know, really sometimes just don't even want anything to do with the wraparound process, many times because of the DCF involvement. With the DCF involvement as well, we have seen that people are also more available, but there have been challenges with regard that, you know, people have their own children too that they're trying to care for. As professionals, we're trying to care for our own children in the background while we're trying to do our jobs. So that does happen a little bit more often than in the past when people were in their offices or able to travel in the community. And so sometimes we've seen that other workers are not available because of the challenges of childcare. And then as far as families have been very resilient through this process. We have a lot of families that have numerous children, and they have been ready and available to us to receive the intervention and receive care. And so that's been nice to see as well. You can go ahead to the next slide. And so because of the flexibility of the wraparound process, we really haven't had to change much of the way we do things, but we have been able to use the flexibility of the process to, you know, now we have 2 visits a week where we meet for shorter times versus 1 long visit. We are calling more often. We're connecting with other supports more often. You know, usually my team covers the entire state. They don't have to travel as much. And so we've been able to connect with resources a little bit more as well. And these are just some wraparound really values that we look at when we're engaging with families that still stay the same despite the COVID-19 pandemic. And so I just wanted to add this slide just as a takeaway. This is the attitude that we come with working with families no matter the situation. And we continue that throughout the pandemic to have a positive attitude to make sure families have the space they need to feel like someone's listening to them, and to make sure we are respecting their backgrounds, what's important to them first before we come and swoop down with what we think is right. So that is kind of it in a nutshell. I've never done this in 10 minutes. Usually it's a 2-day overview training. But yeah, hopefully that gives you some insight into what we've been able to do.
You've done a great job, and I think a lot of the staff on the line are wanting to line up for your services as well, as we're stuck at home with our lovely children. So there are some key websites that you're sharing with us. We do have a few minutes if folks have any questions that they want to put into the chat box, or any of the Housing Innovations team that might have
I
questions.
just was wondering if, do you recognize me, John?
I will now recognize the woman from New York, the esteemed colleague from New York.
Suzanne, thank you guys so much. I'm just curious if you're seeing increases like we're seeing in some domestic violence situations with people being home all the time and together, and how you're assessing that when you're not in the home, you know, what's going on in terms of risk or neglect or abuse, and kind of what that looks like in COVID in a virtual service model.
We definitely are seeing that caregivers are more stressed, for sure. I would not say that we've seen, and Andrea, I don't know if you could speak for the IFCS program, but we haven't seen necessarily an increase in domestic violence or you know, family violence situations, but we still have about the same amount of challenges with regard to domestic violence. And so the great thing though is that families still have been having access to, one of our families went into a domestic violence shelter just recently, the last couple of weeks. So they have had access to the support and care with regard to the domestic violence issues. So that's been nice as well.
What about child abuse and neglect? Has that increased?
Not on our side. As far as the referrals that we received, no. There may have been an increase within the DCF system, but those referrals have not come over to us necessarily.
I think my understanding from DCF is that the number of referrals actually has gone down because kids haven't been in school and haven't been doing sports and in the community, you know, where there are people, you know, sort of looking out for them. So the number of referrals has gone down, which is, you know, certainly concerning, I think, for them, but they're starting to see a little bit of an increase, because of course now, you know, everybody's inside, so there's nobody to really report, you know, any concerns about child abuse and neglect. But they are still visiting. They are still doing investigations when calls go into the care line, taking precautions, of course. Regarding domestic violence, I think that I don't know that there's been an increase in domestic violence, but certainly the concern regarding families experiencing domestic violence has increased simply because of, you know, the increased isolation that families have.
I would also like to add that many of the challenges that we've seen with families around school issues and children having a higher levels of anxiety because of the constraints of the school environment have lessened. And so many of the youth that we serve have had an additional challenge and anxiety around school, and we've seen that lessen. So in essence, many of our children are doing better because they're not stressed about school. And I can even say personally for my own son, my 12-year-old, a lot of his challenges are around school, and he doesn't have that right now, or it's minimized. So I think that's where we've seen a decrease in anxiety in the children we serve.
Great, thank you. So Shamika and Andrea were foolish enough to share with us their email address. So on the next slide, you'll see where you can get a hold of them. Thank you for making yourselves available to us both today in a very short period of time and through email. And it sounds like if folks are interested in a longer training for their staff, you might be available to do that as well. I see Shamika shaking her head. Good. Well, thanks again. So then our last slides are just our next steps and resources. We will meet again as the COVID office hours on July 10th. For folks who are part of the steering committee of Balance of State, you'll meet with us in about a half hour. What we do every other meeting is we do it. That's fine. We do a deep dive on a particular topic like we did today, and then the following meeting, it's basically CT BOS updates. So in 2 weeks on the 10th, it'll be, or it's more than 2 weeks from now. Whatever, I've lost track of time. What day is it? But on the 10th.
In 2 weeks, we got the 4th of July, John.
That's why we're pushed out a week.
Got it. Thanks.
Yeah, remember we had to rearrange the schedule because of the 4th of July.
See, all these holidays. So enjoy the 4th. We'll see you on the 10th. And then just additional links that we have and webinars and resources. And it's all good stuff. We want to make sure you have a full library of resources. And then, of course, the last slide is always, don't call your 3 co-chairs. Call Suzanne and her team. General informations can go to ctbosscoc@gmail.com. And
the slides were posted in the chat box, John. People wanted to download them and they didn't get them by email.
Great. And Sarah Berry says that Prince Crandall Center DV program here, they are starting to see an increase, but more clients not willing to come into the shelter, which is certainly understandable. And just a reminder that we do have rapid rehousing funds that are targeted specifically to the DV population. So if you want more information about that, you can contact CCADV. And I'm not sure if Annie's on the call today, but we can certainly get you contact information. Any other comments for the good of the community? If not, let's see, 7 minutes. We're giving you 7 minutes of your life back. Don't squander them. Remember, be kind to yourself, be kind to people around you. We're living in very fragile times. Let's be the peacekeepers and the peacemakers. And with that, we'll see you on July 10th or in a half hour, whichever comes first. Bye, everybody.
Bye.
Thanks, everyone.